mental health in Nigeria is actually alarming. Because there's two reasons. One, unawareness. Two, we don't know what it is. I'm not looking at the economy as one of the biggest factors. If we are prepared, it doesn't matter how the economy is, we can manage it. But because we don't know what it is, that is why it's going down. Because 60% of the people who are having mental challenge, they don't know what it is. Mental health is not picking cans in the streets. Mental health have gone beyond anger, beyond depression, beyond low self-esteem, beyond a whole lot of crazy things that we don't look at. That is what mental health is. What actually worries me the most when I talk about mental health in the Southeast is, aside from stigmatization, we talk about awareness. Awareness. We don't know what it is. I will repeat it again. Then secondly, we've made up our mind to spiritualize everything that we don't know. We don't want to learn. We are not open. We are not teachable. We always find an excuse for even our own mistakes. We need to learn how to understand what we are looking for. We need to understand how to understand what is right before us. And that thing that is right before us is what? Mental health. And what is mental health? Mental health is not the act you see, it's what is preceding the act. Let me move a little bit. If you want to catch mental health, don't look at the mental health itself. Look at pray. For everything that are signs, there are symptoms. They don't just hit you overnight. There are warning signs. And now, when I talk about Southeast, we have this thing in the back of our mind. Not wanted, dejected, not accepted, these are not this, every reason is for us. It is not us. It is us who is doing us and not any other person that is doing us, because we refuse to change. If you look at things from where they are, the level will be down. And secondly, let me use psychological terms called signposts. Signposts. In Southeast, every person is a counselor, every person is a therapist, every person is a mental health professional, every person is anything. Why not say, I know every person has a bother. Until you know your bother, we can't get it right. That's basically one thing. We need to know our bother. I'm a mental health specialist because I did a 6 months, training in trauma. He's a mental health specialist because he did a 6 months training in evaluation. The other one is a mental health specialist because he did a 6 months or 3 months online course in any of the psychological, stuff, evaluation, development, all this one. Because you know how to manage crisis. That doesn't make you a certified mental health specialist. It doesn't matter what it is. There are environmental factors, there are rudiments attached to it. How many of us know how it's been done? You are trained to have a certificate. That is not how to take care of mental health. Because you have somebody that you can put a call through and the person will bring it down. That is what destroys mental health the more. 90% of the people who leave mental health activities in Southeast are unprofessional. They may be well read, yeah, I'm not disputing that. Graduates, good. No, they are good. But do you know, number one, the actual cause of that mental health? Number two, the actual type of mental health you want to manage. Number three, the reinstation. When you succeed in managing it. Number four, blocking what we call rebounds. A lot of people go through rehabilitation and still they rebounds. You know how to manage it. Relapse, rebounds is a normal thing, but how does it come? To what degree can you manage it? So mental health care doesn't need medication. Most of them don't need medication. They need a psychological evaluation that has to do with proper psychological counseling and psychotherapy, not local advice and instruction based on Panadol worked for Chika, it's going to work for Chinedu. After all, it's the same frontal lobe headache. Engage the professionals, engage them. People that spent years in the university studying mental health, knowing what it is, how it comes, the secrets behind mental health. Every psychological dysfunction and mental health gives you 3 basic symptoms and signs. But the question is, how do you identify which actually it is? I give you an instance. Headache is a basic symptom for hunger, stress, malaria, typhoid, pregnancy, and a whole lot of things. So how do you know exactly why I'm having this headache? Is this something with mental health? He's angry, he smokes a lot, he's into drugs. You need to know the difference between bipolar, schizophrenia, regular mental health that has to do with depression, which of them is genetic, which of them is environmental. How do you break those things down? That is where professional is needed.